In my experience, most tubal ligations can be reversed. The only tubal ligations that cannot be reversed are when the doctor removes both of the tubes in their entirety. We can reverse at least one tube in 98% of patients. The best way to determine if you are a candidate is to send us a copy of your tubal ligation records. We don't charge to review tubal ligation records. For more information on how to send us a copy of your tubal ligation operative report, refer to our website. You will find more information under the section entitled Getting Started or Contact Us. There are two tubal ligation records you need to be aware of: the tubal ligation operative report and the pathology report. When a doctor does a procedure in the operating room, they must create a report describing exactly what was done during the procedure. This is called the operative report. The tubal ligation operative report is helpful because it tells us what was done during the procedure. All tubal ligation procedures have an operative report. If pieces of your tube were removed, then this tissue must be sent to a pathology lab, where a doctor will look at the tissue, measure and describe the amount of tube removed. If pieces of your tubes were removed, then there should be a pathology report. The pathology report is helpful because it confirms how much of each tube was removed during the procedure. If your tubes were tied and cut, then you should have a pathology report. You will not have a pathology report if your doctor did your tubal ligation with tubal clips, tubal rings, tubal burning, or the Escher procedure, because during these procedures, pieces of the tube are not usually removed. If your doctor performed Escher or Adiana tubal ligation, then you won't have a pathology report. But you should have a 3-month after Escher confirmation x-ray to confirm that your tubes are closed. And we would like to review that before considering you a candidate. If you'd had a vasectomy, then we don't need a vasectomy operative report because it is very rare to remove large segments during a vasectomy. If your vasectomy was done in an operating room setting under deep anesthesia, then we recommend you send us the operative report for review. The best place to get your records is by looking in your electronic patient medical record that you may have online access to. With technology, more and more people have immediate access to their records online using their electronic patient medical record. If you have online access to your records, the best and fastest way to get your records is by going online and downloading your own records. If you don't have online access to your records, then the next best place to get your reports is from the medical records department from the hospital where the tubal ligation was performed. Everyone wants to contact their doctor for their records. Keep in mind your doctor may have your record in the office chart, but the hospital will have your records and it is required that they have your records. So the hospital is often the best place. You can try to contact the doctor who did your tubal ligation, and sometimes they will have a copy of your records inside your office chart. I recommend patients have the records sent directly to them. That way you know once you get them that you have them. And once you have them, you can then send your records directly to us for a free review. The benefit of doing it this way is you will have a copy of your own records. You will know when you get them, and you will know when you send them to our office. Often, patients will contact their doctor or hospital and ask them to send the records. It could be several weeks before the records are sent, if they're ever sent at all. Many times your doctor will send them to us, but not include any contact information. And we don't know even how to contact the patient with our interpretation. Many patients will call us and say, "I sent you my records. Why haven't you contacted me?" Only to realize the hospital hadn't sent us anything, or we had the records under a different name, or we don't have your contact information. So it's better if you have records sent directly to you, and then you can send the records directly to us. Make sure you include a way for us to get back in touch with you. We will usually respond and provide you an interpretation within 48 hours. Many states have rules regulating how long paper records need to be maintained. As electronic records are becoming more common, Often, these electronic records are being kept forever. If you have older paper records, many states have laws specifying how long these records should be kept. Many states required records to be kept for 8 to 12 years, and after that time, records can be destroyed. If you are unable to get your records, you have two options. Option number 1, come for surgery without records. Option number 2, consider our optional screening laparoscopy. We can repair most tubal ligations. Many patients are happy with this fact and will come for surgery, understanding most tubal ligations can be repaired. We do not require records before you can schedule. We are the only practice that offers patients screening laparoscopy. This is a procedure we perform at the very start of reversal surgery while you are under anesthesia. We insert a small camera into the belly button. This allows us to look directly at the fallopian tubes. If the tubes can be repaired, then we will do so. If the tubes cannot be repaired, then you only have a small incision. The surgery is less than 10 minutes, and we provide you a refund of the surgical fee. The screening laparoscopy is always optional and never required. It can best be thought of as an insurance policy that your tubes can be repaired.